Hello everyone and welcome to another day of high yield USMLE questions. So today we will be talking about psychiatry. So a 26-year-old female patient presented with acute onset shortness of breath, palpitations, sweating and chills. Her sister who brought her gives history that the patient has been having these episodes for the past 3 months, but when they come to the emergency department, all the tests including ECG are clear. The patient also worries about the occurrence of next episode. Which of the following is the mechanism of action of the drug to immediately relieve this patient's symptoms? So if you look at this is episodic. Like here they say there is episodes, and episodes include shortness of breath, palpitations, sweating and chills. Remember, the patient still has active symptoms, so they want to know what will be the immediate next step to relieve this patient's current symptoms. So also remember that they said there is increased worry that about the occurrence of next episode. So this is classic for a panic attack. So this is a panic disorder. So usually the panic attacks will occur out of the blue without any reason, and there will be like palpitation, shortness of breath, sweating, chills, paresthesias. Those are the things, and sense of impending doom. So those will be the features of the panic attack. So and remember, episodic. So and then there is also, remember, a type of anxiety called the performance anxiety, and there is also specific phobias as well, like height. So this is different than that. This is just without any reason. For the specific phobias, the reason it's called specific phobia because there is a reason. For example, a patient afraid of heights. So that will be a specific phobia example. So this is definitely panic disorder. For panic disorder, usually you need to know that why the paresthesias happen. Remember, there is also paresthesias. They may ask the question. So remember, the patient hyperventilate, right? There is increased ventilation rate. So when they hyperventilate, they breathe out. They kind of expire PCO2. So if you expire PCO2, there is decreased PCO2. If there is decreased PCO2, that actually causes, if this is a brain, it actually causes the vessels in the brain to constrict, and the vessels in the brain, if are constricted, the area that is supplied by the brain may not have enough blood, and that actually causes the paresthesias. So this is the proposed mechanism for the paresthesias in panic disorder or panic attacks. So let's see what is which drug is going to be used here immediately relieve this patient's symptoms. Remember, now there are active symptoms, so you need to give benzodiazepine. So let's see which of the following would be the mechanism for benzodiazepine. First, they said serotonin reuptake inhibitors. Remember, SSRIs and SNRIs, right? And cognitive behavioral therapy. So these are treatment options for panic disorders. But remember, these are for maintenance, not to relieve the immediate symptoms. Here, we need to immediately relieve this patient's symptoms. So these are not going to be the ideal choice. This is for maintenance. Like, this is to prevent further panic attacks. So here, it's not a right option. Non-selective beta blocker. This would be propranolol. Remember, this is for performance type of anxiety. So if the patient is giving a presentation and is nervous before the presentation, the patient can take propranolol, a non-selective beta blocker. Here, it won't help with the panic attack. Then we have increased frequency of chloride channel opening. So remember, this is the one that is going to be the benzodiazepine. So this one is the right answer. This is the right answer. These two are wrong. So, and then we have the last one, which is the D2 receptor antagonist. These are antipsychotics, so used for schizophrenia, but here they have no value. So just remember, for immediate symptoms, benzodiazepine; for long term, for maintenance, SSRIs, SNRIs, and our cognitive behavioral therapy. So if you like the video, please subscribe and like the channel. And if anyone wants tutoring, can email me here. And also, if this video helps you in your preparation, you can consider supporting the channel at Buy Me a Coffee, link in the description. Thank you for watching.